again, welcome to my Oet channel. So today I came with another one Oet role play card. This is one recent exam question and we will see the scenario. It is happening in local clinic and they have given instruction. You see a 21-year-old patient who presents with a high temperature, a sore throat and swelling in his or her neck. You have just examined, underline that point, you have just examined. That means this is a noun case. The patient and suspected glandular fever. In bracket, they have given infectious mononucleosis, also known as mono. So this is the thing they have given in the instruction. So it is clear that it is a noun case. You have already started the conversation. And if you are unaware about noun case speaking card, I will tell you in this type of case, role play card, no need for self introduction. Okay. So how we will start a conversation then without introduction? You can just ask patient name during 3 minutes preparation time. Example, patient name is Peter. Then how we can start a conversation? Well, Mr. Peter, thank you for allowing me to examine. Then you can start with the task. Okay. So our first task is find out more details about patient symptoms like onset, severity, treatment, tried. So if there are many questions in the bracket, always it's better to ask two questions together. Two questions together you can ask, because if it's practically patient will listen only the last question. He could not or she could not concentrate on all three questions if you are asking together. So how we can ask here? Well, Mr. Peter, thank you for allowing me to examine. So before proceeding further, may I ask you some question if you don't mind? Yes, the answer will be yes. Then we can ask that. Okay, could you please tell me? So from when it start, and what may be the severity of your symptoms? Maybe whether it is minor, more minor, mild, or moderate or severe. Then the answer will be yes, sister. Actually, this problem got started few days ago, maybe 4 or 5 days, and the severity it's like my moderate. I can bear the pain and everything, but still it is somewhat irritating me. Then we can tell that, okay, Mr. Peter, could you please tell me, have you tried any treatment at home? So the answer will be for throat pain. Actually, I have tried only the nebulization. Other than that, nothing. Then the next task is explore any other symptoms like headache, fatigue, loss of appetite, chills, nausea. What do you mean by explore? It's nothing but find out. Okay. So we can ask a few more questions. I would like to ask you that, do you have any other symptoms such as headache, fatigue, loss of appetite, chills or nausea? So the answer will be yes, of course, I have all the symptoms. Then the next task is give likely diagnosis of glandular fever or infectious mononucleosis. Example, a viral infection, Epstein-Barr herpes virus, contagious, most common in 15 to 24 years old. So we can tell that, okay, thank you for your answering, Mr. Peter. From my observation, what I can tell you that your problem is known as glandular fever, or medically we used to call it as infectious mononucleosis. It's nothing but is a viral infection caused by Epstein-Barr or herpes virus, and I can tell you that it is contagious. That means it will spread from one person to another one person, and this is a common infection in 15 to 24 years old person. So no, nothing is there to be worried. We have effective management for this condition. Are you getting my point? Like that we can ask. Then we can ask, do you have any concern? Okay, so in between you have to involve the patient. You should not talk continuously. So the possible question will be, okay sister, I can understand. So is there any need for GP's appointment? Then we can tell that the task is advice need for GP's appointment for blood test, confirmation of diagnosis, ruling out other illness. So we can tell that yes, of course, it is mandatory for you to have GP's appointment for further blood test, and he will confirm your diagnosis. He will exclude any other illness. So what do you mean by rule out? Actually, it is not reveal. Okay, it is exclude something. You can Google it so that you will get clear idea about rule out. Then we can tell the other next task is give information about transmission of virus from infected person through saliva, carrier often asymptomatic. So we can tell that. For your further information, I would like to tell you one thing, Peter. As I told you, it is a contagion, that is a transmission. It will transmit from one person to another one person, which is a strong virus. um, from infected person through saliva. It can spread if you talk, and if you cough, the virus can come outside and can stay in the air. Those who are nearby, they can get this condition very easily. And the carriers are often asymptomatic. Those who have active infection, they will be asymptomatic some of the time. Then we can ask, do you have any more concern? So the next task is recommended self-care, rest, fluids, pain relief as required, salt water gargle, no medication necessary. So the question will be, the possible question will be, okay, so until GP's consultation, what I can do to relieve my symptoms? Then we can tell that, yes, Peter, I can truly understand your concern. No need to worry, I will explain you. It is advisable for you to take adequate rest, take oral fluids, and if you have pain, you can take any over-the-counter medication such as paracetamol. And for throat pain, you can do salt water gargle. Actually, there is no specific medications are required for now until doctor's appointment. As early as possible, I will get you the appointment to see your GP so that he can examine you and he will provide you the medication. Is it okay for you, or how does that sound? So the answer will be yes, of course, I will try to follow all your advices. Then we can tell that once again I'm reassuring you that nothing is there to be worried. It is a common, quite normal condition, and effectively we can manage with the self-care and antiviral drugs which is prescribed by the doctor. So, do you have any more concern? Answer will be no. So, if you don't, I hope I have clarified all your doubts. If you don't have any other question, may I proceed with the doctor's appointment? Yes. So, with that, we can conclude. Okay. So, it is a suspected. Actually, they have kind of suspected. So, when you are telling from my observation, what I can tell you that it is more or less look like glandular fever. Like that, you have to explain. Okay. One thing I forgot to tell you. If it is given suspected, you have to tell in that way only. Then in the last section also you have to give somewhat along with the recommendation you have to give some reassurance also, because until the doctor's consultation there is no medication from the clinic. So you can give some self-care along with the this reassurance, then you can wind up the conversation. Okay, it is a simple question paper, and this is first role play card. So it will be small and you will get adequate time. But in the second role play card, you have to be smart enough to manage your 5 minutes, because there will be a lot of subtasks, and don't talk more than what you require, and don't elaborate the sentences and all in the second role play card. In first, it's okay, you can elaborate somewhat. So I hope this video is helpful for you, and you please go through the steps and try to practice by yourself or with somebody with you, and get the confidence to handle every role play cards. Okay, if you practice many cards, of course you will have that courage, or if you have the confidence, when you will get the confidence, then freely you can sit in front of the interlocutor. You can handle them very easily. So I hope it is beneficial for you, and practice in the same way. We will meet with another one informative video. Until then, bye, take care.